Hello, my name is Mark, and this is my response to discussion board 6 for HCA 300. Within the video, we see people being surprised by billing amounts due to hidden costs such as facility fees and out of network access for emergency situations. Even when a person has insurance, when it comes to out of network fees, this means you have seen an out of network provider, which you may or may not have known about, and you and yourself will be responsible for the fee of service. Some personal experience I've had with this would be in 2017. I was actually involved in a car accident where a cop rear ended my girlfriend and I. After the accident, we went to an emergency room, which was in network for our insurance coverage, but the emergency room physician on staff that night was actually an out of network provider. Because of this, I was personally charged a fee of service from the out of network provider for $1,000, and it was not covered by my insurance. Luckily, last year, Nevada actually passed Assembly Bill 469, which helps alleviate costs, as the bill's purpose is to, and I quote, to limit amount providers of healthcare may charge a person who has health insurance for certain medically necessary emergency services when the provider is out of network. This also requires insurances to either transfer a person who has coverage with them to be transferred to an in-network facility, or the insurance will have to pay for the fee of service when it is actually a medical emergency and the person cannot be transferred. This bill is actually very useful and could be implemented into other states, relieving people of cases of surprise billing and other costs.
A suggestion I personally think would help reduce high costs related with healthcare usage is to monitor all hospital facility costs. As said in the video, the facility cost is the cost of just walking through the hospital doors, and it is what essentially keeps the emergency room open 24/7. These costs can be very different depending on the hospital. I think that we should monitor all facility costs so that no hospital can overcharge people. Another thing that could reduce costs would be giving patients more options. In the video, they talked about some situations where the only aid given was a Band-Aid or ibuprofen. They are then charged the facility costs plus very expensive ibuprofen or a very overpriced Band-Aid. But they are not given the option to refuse the aid and get it on their own because most people have Band-Aids and ibuprofen at home already. So instead of being charged both the facility cost and the aid, the patient could at least only pay the facility cost.
Even though there are not many options when it comes to reducing healthcare costs, even with insurance, 3 ways that we can reduce high costs related to healthcare is to 1, stay in network and always ask a lot of questions. Because just because you are in network does not mean that you are safe from high cost. Just like the gentleman in the video, where this gentleman who needed the jaw surgery, he thought he was safe because he was in network, but little did he know that the provider was out of network, which resulted in a high cost. And the second way to reduce healthcare cost is by renegotiating the price beforehand or renegotiating the medical bill. And this may or may not work, but it is definitely worth the try. The third way is to set up a health saving account. A health saving account is an account that can be used to pay for qualified medical expenses. However, just like everything else, there are some pros and cons to it. One of the disadvantages of a health saving account is that you have to be enrolled into a high deductible health plan to be eligible for it. However, with that being said, there are many advantages to it, such as having to save money for medical expenses and being able to withdraw money tax-free. And some people use it to invest in retirement, and sometimes the insurance company contributes by putting money into your account. And there's also something called a premium pass contribution, which is when the insurance put money into your account. That money, it's yours. Another good thing about it is how the money that is not used this year just rolls over to the next year, and the money stays in your account until you withdraw it.
In order to reduce high costs related to healthcare usage in the United States, it will involve major changes within the foundation of our healthcare system. The first step in curbing the cost will be to vastly accelerate our efforts to decrease healthcare spending overall in ways that will not shift the burden of the cost onto insured persons. Some possible solutions to lessening the cost without shifting it to those insured would be to begin reforming the way in which healthcare is delivered and paid for. Rather than value-based care, we should be promoting value-oriented. Another example would be to focus on preventative care. By following a team-based approach, which will involve the coordination and cooperation of not only physicians, but hospitals and other healthcare professionals as well. Next, we must begin to push for transparency of quality data and pricing, so that employers, patients, and payers can be better informed of the actual cost of services that they may need to receive. Lastly, we must pay special attention to the allocation of resources and consider the cost based on the best and most current medical evidence that is available to ensure that limited resources are put towards cost-effective services. In order to implement this, it will involve major changes to the foundation of our current healthcare system. However, these changes are necessary for the overall health and safety of communities nationwide and for future generations to come.